Article 760 addresses direct exposure to infectious substances. Several key points require clarification. Firstly, what constitutes direct exposure? Secondly, when does Article 760 apply? And thirdly, what are the specific requirements outlined in Article 760? Direct exposure is defined as the contact of skin, mucous membranes, or other body tissues with an infectious substance. This exposure can occur through contact with blood or other body fluids, contact with contaminated objects or surfaces, or inhalation of airborne infectious particles. Article 760 becomes applicable in two primary scenarios. Firstly, when direct exposure to an infectious substance actually occurs, and secondly, when there is a potential for direct exposure, such as in laboratory or healthcare settings. When direct exposure occurs or is a potential risk, the employer has several specific responsibilities. 1. Identify the source of the infectious substance and thoroughly assess the risk of transmission. 2. Immediately report the exposure incident to the appropriate authorities and qualified medical professionals. 3. Provide post-exposure prophylaxis, also known as PP, to prevent potential infection. 4. Offer appropriate medical monitoring for all exposed employees. 5. Establish and implement effective work practices and controls aimed at preventing future exposures. These controls encompass several categories. Firstly, engineering controls, such as implementing adequate ventilation systems. Secondly, the provision and mandatory use of personal protective equipment, including gloves and masks. Thirdly, the enforcement of safe work practices, such as rigorous hand hygiene and regular disinfection of surfaces. It's important to note that the specific requirements under Article 760 can vary. This variation depends on the nature of the infectious substance involved and the assessed potential for transmission. Employers bear the responsibility of providing comprehensive training and readily accessible information to their employees. This training and information should focus on the risks associated with direct exposure to infectious substances, as well as effective prevention strategies. For further clarification, or if you have specific concerns, it's highly recommended to consult with a qualified occupational health professional or reach out to the relevant regulatory authority in your jurisdiction. They can provide tailored guidance based on your specific circumstances and local regulations. Understanding Article 760 and implementing its requirements diligently is crucial for maintaining a safe and healthy work environment, particularly in settings where exposure to infectious substances is a potential risk. The focus should remain on preventative measures and ensuring that employees are well informed and protected. To further elaborate on the employer's responsibilities under Article 760, it is crucial to delve into the specifics of each requirement. The identification of the infectious substance source necessitates a thorough investigation. This involves determining the exact substance involved, understanding its transmission routes, and assessing its virulence or potential to cause disease. The risk assessment process should evaluate the likelihood and severity of potential exposures, considering factors such as the frequency of contact, the quantity of the substance involved, and the susceptibility of the exposed individuals. The immediate reporting of exposure incidents is critical for prompt intervention and prevention of further spread. Reporting protocols should be clearly defined, and employees should be trained on the proper procedures for reporting exposures. This typically involves notifying supervisors, occupational health personnel, and potentially external regulatory agencies. Post-exposure prophylaxis, or PEP, refers to the administration of medications or treatments to prevent infection after an exposure has occurred. The specific PP recommended will vary depending on the infectious substance involved and the individual's risk factors. It's essential to initiate PP as soon as possible after exposure to maximize its effectiveness. Medical monitoring for exposed employees should include baseline testing and follow-up assessments to detect any signs or symptoms of infection. The frequency and type of monitoring will depend on the infectious substance and the individual's health status. Work practices and controls are the cornerstone of preventing future exposures. Engineering controls, such as ventilation systems, aim to eliminate or reduce the hazard at its source. Personal protective equipment, or PPE, provides a barrier between the employee and the infectious substance. Safe work practices, such as hand hygiene and disinfection, minimize the risk of transmission through contact with contaminated surfaces or objects. In addition to these specific requirements, employers should also implement a comprehensive written exposure control plan. This plan should outline the policies and procedures for preventing and managing exposures to infectious substances. The plan should be reviewed and updated regularly to reflect changes in regulations, best practices, and workplace conditions. Training and education are essential components of any effective exposure control program. Employees should receive training on the risks associated with infectious substances, the proper use of PPE, safe work practices, and the procedures for reporting exposures. Training should be provided upon initial assignment and annually thereafter, or whenever there are changes in procedures or regulations. Furthermore, employers should maintain accurate records of all exposure incidents, medical monitoring, and training activities. These records are essential for tracking trends, identifying areas for improvement, and complying with regulatory requirements. Collaboration between employers, employees, and occupational health professionals is crucial for creating a safe and healthy work environment. Open communication and a culture of safety can help to prevent exposures and protect employees from the risks associated with infectious substances. Finally, it is important to stay informed about the latest regulations and guidelines related to infectious substance exposure. Regulatory agencies such as OSHA and the CDC provide valuable resources and information to help employers comply with their legal obligations and protect their employees. By diligently implementing the requirements of Article 760 and fostering a culture of safety, employers can significantly reduce the risk of direct exposure to infectious substances and create a healthier and more productive workplace. To further illustrate the application of Article 760, let's consider a hypothetical scenario in a medical laboratory. In this lab, employees routinely handle blood and other bodily fluids that may contain infectious agents such as hepatitis B virus, hepatitis C virus, and human immunodeficiency virus, also known as HIV. To comply with Article 760, the laboratory must implement a comprehensive exposure control plan. This plan should include the following elements. Firstly, a hazard assessment to identify the potential sources of exposure and the associated risks. Secondly, engineering controls such as biosafety cabinets and sharps containers to minimize the risk of airborne transmission and needle stick injuries. Thirdly, personal protective equipment including gloves, gowns, and face shields to provide a barrier between employees and infectious materials. Fourthly, safe work practices such as hand hygiene, disinfection of surfaces, and proper handling of sharps to prevent contamination and injury. Fifthly, training and education to ensure that employees are aware of the risks, understand the proper procedures, and know how to respond to exposure incidents. Sixthly, a written exposure control plan that outlines the policies and procedures for preventing and managing exposures. In the event of an exposure incident such as a needle stick injury, the laboratory must follow a specific protocol. Firstly, the employee should immediately wash the wound with soap and water. Secondly, the incident should be reported to the supervisor and occupational health personnel. Thirdly, the source patient should be tested for infectious agents. Fourthly, the employee should receive post-exposure prophylaxis if indicated. Fifthly, the employee should undergo medical monitoring to detect any signs or symptoms of infection. By implementing these measures, the medical laboratory can significantly reduce the risk of direct exposure to infectious substances and protect its employees from potential harm. It is important to remember that the specific requirements of Article 760 may vary depending on the jurisdiction and the nature of the work being performed. Therefore, it is essential to consult with a qualified occupational health professional or the relevant regulatory authority to ensure compliance and best practices. Additionally, it is worth emphasizing the importance of ongoing evaluation and improvement of exposure control programs. Regular audits and feedback from employees can help to identify areas where the program can be strengthened and made more effective. Continuous improvement is essential for maintaining a safe and healthy work environment and protecting employees from the risks associated with infectious substances. Furthermore, it is crucial to address any misconceptions or concerns that employees may have regarding infectious substance exposure. Open communication and a supportive work environment can help to alleviate anxiety and encourage employees to report incidents promptly. A culture of safety is one where employees feel comfortable speaking up about potential hazards and working together to prevent exposures. In conclusion, Article 760 provides a framework for protecting employees from the risks associated with direct exposure to infectious substances. By understanding the requirements of Article 760 and implementing a comprehensive exposure control program, employers can create a safer and healthier work environment for their employees. This includes identifying potential sources of exposure, implementing engineering controls and safe work practices, providing personal protective equipment, training employees on the risks and prevention measures, and establishing a written exposure control plan. In addition to the measures already discussed, consider the importance of proper waste management when dealing with infectious substances. Medical waste, including sharps and contaminated materials, must be disposed of in accordance with federal, state, and local regulations. This typically involves using designated containers for sharps and biohazardous waste and ensuring that the waste is properly treated before disposal. Proper waste management is crucial for preventing the spread of infectious agents and protecting both employees and the public. Another important aspect of exposure control is the availability of vaccinations for certain infectious diseases. Employers should offer vaccinations to employees who are at risk of exposure to vaccine-preventable diseases, such as hepatitis B and influenza. Vaccination can provide immunity and reduce the risk of infection in the event of an exposure. In addition to vaccinations, employers should also provide access to other preventive measures such as tuberculin skin tests for employees who may be exposed to tuberculosis. Early detection and treatment of tuberculosis can prevent the spread of the disease and protect the health of employees. It is also important to address the psychological impact of exposure incidents on employees. Exposure to infectious substances can be a stressful and traumatic experience, and employees may experience anxiety, fear, and depression. Employers should provide access to counseling and support services to help employees cope with the emotional consequences of exposure incidents. A supportive work environment can help to reduce stress and promote the well-being of employees. Furthermore, employers should encourage employees to report any symptoms or health concerns that may arise after an exposure incident. Early detection and treatment of infections can improve outcomes and prevent complications. Employers should have a clear process for employees to report health concerns and receive medical evaluation and treatment. It is also important to remember that exposure control is not just the responsibility of the employer. Employees also have a responsibility to protect themselves and others from exposure to infectious substances. This includes following safe work practices, using personal protective equipment properly, and reporting any potential hazards or exposure incidents. A culture of safety is one where everyone takes responsibility for preventing exposures and protecting the health of themselves and others. Finally, it is important to stay up to date on the latest information and recommendations related to infectious substance exposure. New infectious diseases and emerging threats are constantly being identified, and it is essential to have the most current information to protect employees effectively. Employers should regularly review and update their exposure control plans to reflect the latest scientific evidence and best practices. By implementing these measures and fostering a culture of safety, employers can create a work environment where employees are protected from the risks associated with direct exposure to infectious substances. This not only benefits the health and well-being of employees, but also improves productivity and reduces the risk of liability for the employer. Continuous improvement and a commitment to safety are essential for creating a workplace that is free from the hazards of infectious substance exposure. Consider, too, the legal ramifications of failing to comply with Article 760 and other relevant regulations. Non-compliance can result in significant fines, penalties, and even legal action. Employers have a legal and ethical obligation to protect their employees from the risks associated with infectious substance exposure. Compliance with regulations is not just about avoiding penalties, it is about ensuring the safety and well-being of employees. Furthermore, it is important to consider the long-term consequences of exposure to infectious substances. Some infections can lead to chronic health problems, disability, or even death. Preventing exposure to infectious substances is not just about protecting employees in the short term, it is about protecting their long-term health and well-being. A proactive approach to exposure control can help to prevent these long-term consequences and ensure that employees can live healthy and productive lives. In addition to the specific requirements of Article 760, employers should also consider implementing broader health and safety programs to promote the overall well-being of employees. These programs can include health promotion activities, employee assistance programs, and wellness initiatives. A comprehensive approach to health and safety can create a more positive and supportive work environment and improve employee morale and productivity. It is also important to recognize that exposure to infectious substances can have a disproportionate impact on certain populations, such as healthcare workers, laboratory personnel, and first responders. These individuals are at higher risk of exposure due to the nature of their work. Employers should take extra precautions to protect these workers and provide them with the necessary resources and support. This may include providing additional training, personal protective equipment, and access to counseling services. Furthermore, it is important to address the stigma associated with certain infectious diseases, such as HIV and hepatitis C. Stigma can prevent individuals from seeking testing and treatment and can lead to discrimination and isolation. Employers should promote a culture of understanding and acceptance and provide support to employees who are living with these conditions. It is also important to remember that exposure control is an ongoing process that requires continuous effort and attention. Conditions can change over time and new threats can emerge. Employers must be vigilant in monitoring their workplaces and adapting their exposure control plans to address new challenges. Regular audits, inspections, and feedback from employees can help to identify areas where the program can be improved. Continuous improvement is essential for maintaining a safe and healthy work environment and protecting employees from the risks associated with infectious substance exposure. In conclusion, Article 760 provides a comprehensive framework for protecting employees from the risks associated with direct exposure to infectious substances. By understanding the requirements of Article 760 and implementing a robust exposure control program, employers can create a safer, healthier, and more productive workplace. This includes identifying potential hazards, implementing engineering controls and safe work practices, providing personal protective equipment, training employees on the risks and prevention measures, establishing a written exposure control plan, and continuously monitoring and improving the program. A commitment to safety and a proactive approach to exposure control are essential for protecting the health and well-being of employees and preventing the long-term consequences of exposure to infectious substances. Moreover, ongoing education and training play a crucial role in reinforcing safe practices and ensuring that employees are equipped with the knowledge and skills to protect themselves and others. Training programs should cover a wide range of topics, including the nature of infectious substances, modes of transmission, proper use of personal protective equipment, safe handling and disposal procedures, and emergency response protocols. Training should be interactive and engaging, with opportunities for hands-on practice and question and answer sessions. Regular refresher courses are also essential to reinforce learning and update employees on any new information or procedures. In addition to formal training programs, informal education initiatives can also be effective in promoting a culture of safety. These initiatives can include posters, newsletters, and toolbox talks that provide reminders of key safety messages. Sharing success stories and best practices can also help to motivate employees and encourage them to adopt safe behaviors. Communication is another critical element of an effective exposure control program. Employers should establish clear channels of communication to ensure that employees have access to the information they need to protect themselves. This may include providing regular updates on new hazards, changes in procedures, and the results of monitoring activities. Employees should also be encouraged to report any concerns or suggestions they have about safety. Open communication and a collaborative approach can help to build trust and improve the effectiveness of the exposure control program. Furthermore, it is important to consider the cultural and linguistic diversity of the workforce when developing and implementing exposure control programs. Training materials and communication strategies should be tailored to the specific needs of the employees, taking into account their language skills, cultural backgrounds, and levels of education. Providing materials in multiple languages and using visual aids can help to ensure that all employees understand the key safety messages. Finally, it is essential to recognize that exposure control is a shared responsibility that requires the active participation of all stakeholders. Employers, employees, occupational health professionals, and regulatory agencies all have a role to play in preventing exposure to infectious substances and protecting the health of workers. By working together, we can create a safer and healthier work environment for everyone.